government's saying lockdown worked. We're in a better place now. Do you agree?
Absolutely not, Tom. This is a lockdown that we should have never had. And quite frankly, it shows that the government has not been up to it in terms of running hotel quarantine or the contact tracing. Now, we must not forget that Victoria, after the second wave, stopped taking international passengers for 5 months, had the opportunity to reset hotel quarantine and get contact tracing right, and they failed. And Daniel Andrews says it's a gold standard, says that our hotel quarantine is something that other states should copy, yet we're taking less passengers than anyone else. And at the first upset, effectively, we have to lock down the state. Each and every one, schools, businesses, everyone affected by this lockdown, because Daniel Andrews had no confidence in his hotel quarantine program and no confidence in his contact tracing.
Well, Daniel Andrews actually didn't say gold standard. He said it was a higher standard of New South Wales because Victoria would take fewer people. The actual failure in hotel quarantine, it seems to centre around this nebuliser. What we have right now is what patient X has claimed and what we've heard EQView, Victorian authorities, have claimed. We don't know for certain who's right, do we?
Well, the problem, Tom, is in Victoria we are running a 2-speed hotel quarantine program. We have 2 health hotels and we have 11 other hotels. And this man, if he in fact was not well, then effectively he should be in one of their health hotels. The fact that we're told that he had certainly had made aware that he was an asthmatic, that he was suffering and that he had a nebuliser with him. And we now hear the government backtracking and the fact that the Hotel Quarantine Commissioner has met with him and given him a private apology. I think, quite frankly, that man deserves a public apology because he was used as a scapegoat during this. What we do know is the fact that it just hasn't been managed well, and this government continually blames everybody else but themselves. The problem in Victoria, Tom, is we keep changing hotel quarantine. The government now wants to move hotel quarantine somewhere else and follow effectively similar situations that we have seen in Darwin. And at the end of the day, what we need is better management. Changing the venue doesn't fix the problem. What we need is people in charge that know what they're doing. Hotel quarantine should be run by infection control experts, not run by effectively a prison commissioner and a police minister.
You mentioned contact tracing. From what we know actually of the past 5 days, should the real lesson be the contact tracing has improved and perhaps the Premier should have more confidence in it rather than going into another lockdown?
Yeah. Look, you absolutely make a good point. If it, in fact, and I certainly think that it's better than where it was. We have heard lots of reports of people having to effectively phone in to the Department of Health to tell them where they were and what they were, and they weren't getting back to. So there's still a lot to be done. But in fact,
okay, but that sounds more anecdotal, though. We've just got to go on the hard data. I know there was the initial report around perhaps 43% were being missed of being chased up. That turned out, from what I understand, not to be accurate. They were initial figures sent through. The final figure on that day, out of the 2,000, they were hitting the benchmark of contacting the vast majority within 48 hours. So, can you say on that front, that's improved? Give some confidence to Victorians.
The simple answer is this, that if it has improved and the government themselves are the ones that have the figures, we've been asking for a lot of the figures and we haven't received those figures. But if the government has confidence, then we shouldn't lock down the state. And I think, we've been calling a number of times to look on other states like New South Wales, where there is a problem. You actually tackle the problem in the area, not lock down everyone as a result. And that's what I would be hoping going forward. And the problem, right now, Tom, in Parliament, we're debating the state of emergency powers, giving Daniel Andrews the power to lock down the state until December, the end of the year. People don't need that uncertainty. We need some confidence going forward. And if Daniel Andrews' contact tracing works, we should fix it.
So the other big concern was the regions. Do you think it should have been within the power of the police? The police force should have been capable, even in a very short period of time, to get enough around Melbourne to be able to conduct enough proper checks of people exiting Melbourne so that the whole state didn't have to go into lockdown?
Yeah, well, again, I don't think we have to put rings of steel effectively to tell people, where there is a problem and ask people to effectively lock themselves down in their homes. We have some of the harshest fine penalties in the nation, but rings of steel are not something that we need. Other states don't use it. I know that certainly Victoria Police are stretched in terms of their resources. We've got 1,000 Victoria Police managing hotel quarantine at the moment. We shouldn't need rings of steel. New South Wales doesn't have rings of steel. They lock down areas when there is a problem. I think what we need going forward is a program that actually relies on giving some confidence on Victorians doing the right thing rather than using the hard, effectively, law and the police to effectively lock down the state and put rings of steel in to stop people from going anywhere. It just doesn't make sense. Victorians have done the right thing. We've got the toughest laws of any state in the nation in terms of policing laws and in terms of some of the things that we've had to do, yet we've had the worst results. So policing isn't the answer here. It's information and confidence in a health system that it actually stacks up and works.